Hello and welcome. Today we're diving into the world of hepatitis B, a serious liver infection caused by the hepatitis B virus. This disease can range from a mild illness lasting a few weeks to a serious, long-term condition. Understanding hepatitis B is crucial for prevention, management, and overall health. So, what causes hepatitis B? The hepatitis B virus, or HBV, is the culprit. It's primarily spread through contact with infected blood, semen, or other body fluids. Common routes of transmission include unprotected sex, sharing needles or syringes, mother-to-child transmission during childbirth, and accidental needle sticks or exposure to contaminated medical equipment. It's important to understand that hepatitis B is now spread through casual contact like hugging, kissing, sharing utensils, or breastfeeding. Let's explore the inner workings of hepatitis B. Once HBV enters the body, it travels to the liver, where it infects liver cells, also known as hepatocytes. The virus replicates within these cells, causing inflammation and damage. This inflammation can lead to liver cell death and scarring, which can eventually result in cirrhosis, liver failure, and even liver cancer. The body's immune response also contributes to the liver damage, as it attacks the infected cells in an attempt to clear the virus. This complex interaction between the virus and the immune system determines the course and severity of the infection. Hepatitis B is a global health concern, affecting millions of people worldwide. It's particularly prevalent in certain regions, including East Asia, Sub-Saharan Africa, and parts of South America, according to the World Health Organization. An estimated 296 million people are living with chronic hepatitis B infection globally. Understanding the epidemiology of the disease helps us target prevention efforts and allocate resources effectively to the most affected populations. The signs and symptoms of hepatitis B can vary greatly. Some people, especially young children, may not experience any symptoms at all. Others may develop acute symptoms, which can include fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored stools, and jaundice, a yellowing of the skin and eyes. Chronic hepatitis B may not cause any symptoms for many years, but over time it can lead to serious complications like cirrhosis and liver cancer. Diagnosing hepatitis B typically involves blood tests. These tests can detect the presence of the hepatitis B virus, as well as antibodies produced by the body in response to the virus. Specific tests can determine whether the infection is acute or chronic, and can also measure the viral load, which is the amount of virus in the blood. In some cases, a liver biopsy may be performed to assess the extent of liver damage. Hepatitis B is often categorized as either acute or chronic. Acute hepatitis B is a short-term infection that usually resolves on its own within a few months. Chronic hepatitis B is a long-term infection that can last for years, or even a lifetime. Chronic hepatitis B can lead to serious liver damage, including cirrhosis and liver cancer. Another important classification involves identifying if someone is an inactive carrier. These individuals have the virus but show no symptoms and have normal liver function tests. However, they can still transmit the virus to others and need monitoring. Treatment for hepatitis B depends on whether the infection is acute or chronic. Acute hepatitis B usually doesn't require specific treatment, as the body is often able to clear the virus on its own. However, supportive care, such as rest fluids and a healthy diet, can help relieve symptoms. Chronic hepatitis B is treated with antiviral medications that can help suppress the virus and prevent liver damage. Regular monitoring of liver function is also essential. Prevention is key when it comes to hepatitis B. The hepatitis B vaccine is highly effective and is recommended for all infants, children, and adults at risk of infection. Other preventive measures include practicing safe sex, avoiding sharing needles or syringes, and ensuring that all medical and dental equipment is properly sterilized. Healthcare workers should follow strict infection control practices to prevent transmission in healthcare settings. The prognosis for hepatitis B varies depending on several factors, including the age of infection, the presence of other health conditions, and the response to treatment. Acute hepatitis B usually resolves completely, with no long-term complications. Chronic hepatitis B can lead to serious liver damage over time, but antiviral treatment can significantly improve the prognosis and reduce the risk of complications. Ongoing research is focused on developing new and more effective treatments for hepatitis B, as well as a cure for the disease. Scientists are also exploring new strategies to prevent mother-to-child transmission and to improve access to vaccination and treatment in resource-limited settings.